I absolutely love finding gems of like GEMS, gems of doctors like our guest today. His name is Dr. Amir Vokshoor. He's a board certified neurosurgeon who specializes in the minimally invasive surgical treatment of adult cranial and spinal disorders. With over 20 years of dedicated experience, he is recognized for his expertise in spinal disc replacement, motion preserving technologies, and his pioneering integrative holistic approach to brain and spine health. Currently serving as the chief of surgery at Providence St. John's Health Center, he has earned an international reputation for his surgical skills and commitment to a comprehensive perspective on brain and spine wellness. Oh my goodness. This is such a great episode. If you know anybody who's dealing with like chronic pain, back pain, neck pain, like feeling like maybe they might need to have surgery, send them this episode for sure and listen to it. Even if this isn't something that is currently happening in your life, like his approach here of like asking lots of questions, finding out what's going on in someone's lifestyle, like how can we avoid surgery? What else can we do? I asked him, I was like, can you just give us personal trainers a hard time? Tell us what we need to hear and all of this. So, yeah, there's just so many gems in this episode. Yeah, I really hope you hear about his non-fusion and motion preservation minimally invasive spinal surgery. He is definitely on the front end of like pioneering new methodologies in spinal surgery, based in LA, not a shocker, in Santa Monica. If you want to find out more about him, you can follow him on social media at Dr. Vokshoor. That's Vokshoor. But if you want to find more information about his practice, go to nsg-la.com, and we'll link these in the show notes so you can just click them. He also has a brain support supplement I would recommend checking out. Sounds amazing. It's Axon, AXONMD.com. He has a nonprofit he mentions at the end of the episode. And if you want to check that out, that's ini.org. And then, of course, he has his own personal website where he does a lot of education on these topics, and that's drvokshoor.com. All right, let's get into it. Here is Dr. Amir Vokshoor. This episode is brought to you by Peluva. So Peluva, Peluva, those are Mark Sisson's new zero drop minimalist shoe with that distinctive 5-toe design. I have been loving them. I've been a longtime fan of barefoot shoes, and I was very resistant to the little 5-toe articulation personally at first, because just being real, I thought they looked really nerdy, and I was like, oh man, yeah, I love Mark so much, and I get what he's doing, but I'm not wearing those nerdy shoes. And then Brad Kearns, who's also involved with that project, was like, no, Tara, you got to try them. Tara, you got to try them. Tara, just come on, try them. And I tried them, and I kid you not, I enjoy them so much that I actually like how they look now. Weirdly, I can tell. So like the purpose of that 5-toe articulation is so that your toes can move more dynamically. So with other barefoot shoes, like I've been a long time fan of Vivos, and I'm still a big fan of Vivos, but they have just that big toe box, right? Which is awesome. So I didn't really feel like the 5-toe articulation was necessary, to be honest. But as I've worn them, I have experienced how awesome that is. It was actually been quite surprising for me. And I wore them this morning. I wear them all the time, and I'm really, really enjoying that freedom of movement of my toes. So, yeah, Brad and I have been going back and forth. I'm like, dude, I actually love them. And he offered to sponsor the podcast with Peluva and also offer you guys a 15% off code, which I was like, okay, cool. Yeah, I will gladly introduce my people to Peluva shoes. So you can use code Coach Tara at peluva.com, or you can just go to peluva, peluva.com/Coach Tara, and you can get that 15% off discount. Make sure you snag some of the socks while you're there, because you're going to need the toe socks. Okay. All right, let's get into the episode. Okay, so Dr. Vokshoor, we just mentioned before starting that I'm excited to have you as a neurosurgeon, very much in Western medicine, paradigm shift my people right now about this holistic approach that you take to back and spine, spine and neck, back and neck, spine health. And so I was wondering if you could just kind of lay out for us What is this more holistic approach? You don't just have somebody come in your office and just be like, okay, surgery time. What does that look like in your day-to-day practice?
Yeah, I think as a physician, very early on, I realized that some of the tools that we have only have so much bandwidth, and they're just a lot out there that's helping patients. Things like acupuncture. Like no,
Hmm.
to this day, we're like, how exactly does acupuncture work? And it has some benefits and it has some drawbacks, etc. But I felt like very early on, I recognized that unless I was augmenting my practice with a more integrative approach of all things applied neuroscientifically in a way that is somewhat evidence-based, but sometimes, with a leap of faith,
Hmm.
I feel like it would work. So, um, and that's when I realized that our training in Western medicine is a little bit myopic because it only teaches you an aspect of healing that's sometimes related to trying medications, trying drug one disease type of situation, or surgery related, interventional related. And I was all about it until I realized that the outcomes cannot be predicted at a really high success rate in a uniform, sustainable fashion.
Mm.
So then I was like, okay, what are we missing?
Yeah.
We're obviously missing a piece of the evidence, but we're also missing some of the other physiological and psychological and even structural markers that can be optimized around a health event. And that's when I had started looking at everything that has some evidence as to benefiting the nervous system, everything from a cold therapy for decreasing inflammation, to use of bone health supplements, before you have spine surgery, for example. So some of it is very common sense. You need
Hmm.
good substrate, you need good anatomy, and you need good psychology to have an intact nervous system. But the last thing I wanted to mention is all the information that's coming out recently about the mind-gut connection, about how the microbiome is so important in setting our physiology, our mood.
Hmm.
So then I started looking at those, like the relation between some of these neurologic disorders, including chronic pain, with the gut. And if you're a true curious scientist, you realize that it's not as clear cut as we had been taught in Western medicine, even with some of the musculoskeletal disorders such as arthritis and degenerative disc disease and things of that sort. They have a more grander nervous system component. So it's either in the immune gut brain axis needs to be considered if you want to have sustainably good outcomes.
Mm. So if let's say I came into you and I'm like, oh my gosh, I think I need back surgery. What happens? Where do you go with that?
Yeah, so you would come in and the first thing we would assess is obviously what is exactly your complaint. Like if you listen to a patient throughout their sort of life journey. If you truly listen, like 99% of the diagnosis is there. My professors used to tell me this, and I used to be like, no way. You need the MRI, you need this, you need that. But they were right. If you truly listen, so much of the diagnosis is in the history, is in the actual story. So I think really good assessing the situation,
Hmm.
and then looking at aberrant anatomy, the disc that's herniated, aberrant physiology, look at gut health, look at the exercise program, look at sleep hygiene,
Right.
look at pain not as in just a musculoskeletal fashion, but pain that is deeper, pain that comes out of nowhere, the
Mm-hmm.
periodicity of pain, all of that really matters. Everything from hormones to things like grief, things that you would never
Hmm.
think about can exacerbate someone's pain,
Yeah.
and we have to take those into consideration. And then ultimately it's about making an accurate diagnosis and assessment. And then if surgery is the best way to treat that problem, I'll be very forthright with it, and I'll say this may come as a
Hmm.
shock, but you'll actually benefit from surgery in a timely fashion. because you don't want to have nerve damage. You don't want to keep this pain going. You don't want your muscles to get used to this level of contracture
Right.
that this problem has brought upon them. And many times it's surgery is not the only answer, or it's not the first answer. And timing of that surgery is really important. So then we would
Yeah.
start with things like traction or physiotherapy or cold therapy, or things that bring down inflammation, or dietary modifications, and certainly an exercise program. And that's probably the most important thing. Can we get the body to move in a therapeutic fashion that it can try to heal itself through lubricating itself? And
Mm,
a lot of joints just need that many times.
mm,
And even if they need surgery, that approach helps with the outcome.
mm. Yeah, I love going back to what you said about really asking. I've learned over the years in coaching, one of the best questions I can ask is, why do you think? Why do you think you're tired all the time? I'm just curious what your thoughts are. Because then you find out all this stuff you wouldn't have known. You're like, oh, well, it looks like your blood sugar. Let me look at your labs, and oh, maybe it's blood sugar. Maybe it's this. And they're like, surprise, sucker. I'm up till 2 a.m. every day surfing my phone. And I, you know what I mean? It's like you find out information you didn't know when you just continue to ask and ask and ask and ask and ask. So I love that you take the time to do that, first of all.
Yeah, I mean, that's become more difficult. And as you
Mm-hmm.
know, medicine is under a
Yeah.
contraction attack. So,
Right. How do you
uh,
do that?
yeah, I think the way we've done it has actually become more of a boutique practice.
Mm-hmm.
Unfortunately, we're not a high volume practice, so we don't serve as many people. But
Mm-hmm.
but the ones that we serve, we really spend a lot of time, and a lot of times we are getting referrals for more complicated patients that may have had a surgery. It hasn't turned out the way they want. And one of the things I like to say is, back surgery has some of the worst reputations among all things medicine.
Mm-hmm.
And why is that? That means that we're doing something wrong, or we're not accurately predicting outcomes. So something is off. And I think even from a purely scientific standpoint, we would be well served to integrate the information of what creates an optimal outcome after in
Mm-hmm.
and around spine surgery.
I'm so curious. I don't even know if you have an opinion on this, but I'm curious if you have opinions on like uh, PRP and stem cells and some of these regenerative modalities. What are your thoughts on those?
Yeah, I like to first start by saying I won't be the first to try something that's just out. So there's like super early adopters, and
Mm-hmm.
some of them will be wrong and some of them
Mm-hmm.
won't. I'm
Mm-hmm.
sort of the second class that looks for some evidence.
Yeah.
And then also we do have a really good scientific organization as part of our practice. It's a nonprofit I started. And so we've been trying for like 10 years to create strength of evidence for each therapy that we offer, so we can be accurate, even if it's something I'm really enthused about, which I think,
Mm-hmm.
stem cells and PRP and exosomes fall into that category that I
Mm-hmm.
have exceptional enthusiasm about. But we need evidence, and
Yeah.
we need the evidence to show us how strong it is, so we
Mm-hmm.
can inform our patients,
Right.
accurately. So
Right.
I'm a believer. I think it's funny, in certain joints everything works. Like for the knee joint,
Mm-hmm.
if you give it PRP, if you give it peptides, if you give it lubricants, it works.
Mm-hmm.
Ankle and spine are sort of like that second tier where, yeah, not everything works. And then
Uh-huh.
the spine itself is really complicated because it's dealing with two regular looking joints called the facet joints, and one shock absorbing disc that acts as a joint, but it's not a typical joint. And the cellular matrix of the disc is very elusive. And so
Mm-hmm.
you imagine this three joint complex times, 7 cervical, 12 thoracic, 5 lumbar, and then you
Right.
got your tailbone. And then how's your posture reacting with the hip joint? And what's your gaze like? What's your muscular build? And all of that goes into like realizing, and that's what makes spine so complicated, because what you're looking at on the MRI may not be what is the actual pain generator, which is really important.
Mm. Yeah, I definitely have noticed with stem cells or PRP, it's just like just anecdotally talking to people. Some people are like, "Oh, it saved me. It was everything," and other people are like, "Didn't work." You know, that is kind of the anecdotal reports that I get.
I'm N of one myself on the one that like it didn't work in my ankle joint for
Mm,
some reason.
mm,
And I had a surfing injury and I tried everything after 3 surgeries, and it still gives me trouble, and I'm
mm,
sort of a guinea pig of everything I offer my patients as well, because I like to make sure that it works on me first. So I think PRP and stem cells are definitely ones that I think stem cells are the most exciting ones and are the ones that are going to make the biggest difference.
mm,
Exosomes are basically parts of stem cells that are active because they have certain peptides or certain molecular groups that act like as the most active part of stem cells, which I think are really important. But again, strength of evidence.
mhm,
We need to say for this kind of problem, for degenerative disc disease of L4, L5, where the disc is still somewhat intact, so has like a boundary, but it's just collapsed and degenerated, but maybe not bone on bone and maybe not full of air. In that circumstance, this type of exosome has a 75% benefit. That's the kind of
mhm.
evidence I'm looking
Right.
for to make it mainstream.
Yeah.
But am I excited about it? Absolutely. Have I done it?
Yeah.
Yes. Am I offering it to patients? Absolutely. But
Yeah.
the informed consent is so long about,
Right.
what we're doing together, and I think it takes a little bit of courage, bravery, but also data, data, data. We need real
Mhm,
world data. And
mhm.
that's why your type of podcast really impresses me from that standpoint, is because you know, you get PhD neuroscientists and surgeons and other informed
Mhm.
people in their field to come and give you a little bit of their magic. And
Right.
I think that to sift through the fog of misinformation in this day
Right.
and age, we need this platform to act
Totally.
responsibly, and
Yeah.
that's why I'm here
Mhm.
today.
Mhm. Yeah, thank you. Yeah, no, it's such a gift. I'm very fortunate, right? Because you get to get the word out to more
Right.
people of like this is what's actually going on the inside. I get to learn and then everybody else gets to learn too. So it's like a win-win-win. So thank you for sharing. And yeah, on that whole let's look at the actual data. Just yesterday a client of mine was like, "Hey, my Achilles tendonitis is just like I cannot get it under control." And I'm just texting back and forth on the fly. I'm like, have you thought about PRP? And then right after I sent it, I was like, hold on, let me see what actual data we have on that. And then I'm looking at these studies and I'm like, actually, it doesn't really look great for Achilles tendons. Go ask your sports medicine doctor what they think.
I know. It's
So, yeah.
incredible. It's
Yeah.
incredible. And then there is that N of one, because all of us have had one patient that it just
Right.
worked so perfectly for.
Yep.
Like I have a patient, Parkinson's disease, that he won't mind me talking about his case, because he had a miraculous response to peptides
Mm,
and he wanted spine surgery. And we had done spine surgery a long time ago on him, but he wanted the next disc fixed. And I just, there's something about the story that
mm,
didn't fit. So I couldn't say another surgery on him would give him the biggest benefit.
mm,
So we just kind of hem and hawed, hem and hawed. At times I'm sure he felt like I was torturing him with this wait time. But then we tried a peptide and the pain completely went away. So what does that mean? I feel like, Parkinson's disease, for example, is known to have an intestinal connection. And maybe there were some essential nutrients, maybe things like B vitamins or
mhm.
other very important healing and repair mechanisms, like we call like the homocysteine axis,
Yeah.
which a lot of people talk about. So maybe that mechanism was not able to be functioning well because of some intestinal factors. And then when they
Yeah.
injected the peptide, it worked perfectly. Anyway,
Yeah.
he avoided surgery
Wow.
through this method, and I was just impressed by saying, like I'm ultimately a structuralist. I can put the structure correctly, but for everything else to work perfectly, we need
Mhm.
functional muscles, functional hormones, good physiology, good blood pressure, good blood sugar,
Mhm.
and good psychology.
Yeah. Yeah. Was it BPC or like what
It
peptide?
was
Yeah.
BPP 157. Yeah. Yeah,
Wow.
indeed. Yeah.
Awesome. Yeah,
Which
I'm on
I'm
a
currently the guinea pig of as well. So I will
okay, cool.
report
Me
back.
too. I've had this knee thing going on for
Yeah.
almost a year, and I've
Yeah.
chiro and sports massage and my own rehab and red light and all the supplements and everything. I'm like, okay, forget it. We need the big guns. Time to roll up the sleeves, And so I'm like, I'll start with peptides. If that doesn't work, I'll try PRP. If that doesn't work, it better work. And yeah, it's the BPC and the
Yeah.
157 and the TB 500. I'm also doing one called TP 508 that
Okay.
has some interesting, and yeah, this is very much the guinea pig world for
Yes.
sure,
That's
guys.
that's
This is the guinea pig
the
world.
razor's edge,
Yeah.
of
um,
longevity. That's great.
but so far it's been unbelievably powerful for me. And
Yeah.
I decided to do a round of a growth hormone stimulating one too, just to help that out. And wow, like the growth hormone stimulating one, like my mood, my even my massage therapist is like, your muscles feel way more hydrated than they have in a long time. I'm like, my whole body feels good. So that's a cool
Incredible.
perk. But some people have allergic reactions and some people
Right.
don't respond well. So yeah, it's kind of a little bit the
Right.
wild, wild west for sure.
Yeah, the only thing I truly worry about is, longitudinal studies that look for, heart risk.
Yeah,
Does it cause arthritis in certain joints, or does it cause overgrowth of some cellular type?
totally. We just don't
Yeah,
know.
yeah, we just don't know. But I think as long as it's not causing any acute reactions and we have some benefits, I feel like at least short-term use,
Yeah,
I'm all in.
right. Okay.
Yeah.
Cool.
But
Thanks for sharing your thoughts on
creatine
that.
is another one with really interesting. Creatine
Uh-huh.
has great data now.
Yeah,
And they're trying to tie it to dementia, to muscle mass, and
totally.
it's incredible. I mean, that's
Yep.
where the evidence is actually kind of hot off the press and very, very exciting.
Yeah, yeah. I'm definitely doing that and some glucosamine and like literally everything I can that is kind of low ticket entry
Exactly.
point. We'll see where we go from there. Um,
Exactly.
okay, I was curious, what are the most common lifestyle contributors to someone winding up in your office, would you say?
God, yeah, you said it. I mean, we're a sitting society, right? So, like the long haulers, the truck drivers is,
Mm,
probably the worst profession,
wow.
I would say.
Mm,
So I always tell those guys to like get into a core program, between on their breaks, definitely engage. You can even do things during driving to engage your core. So like I think core strength, holding on
mm,
to muscle, and balancing, sugar physiology are the basics. Sugar and blood pressure and sugar physiology, like glucose
mm,
physiology, is
mm,
probably the lowest bar that we can all try to achieve.
mm.
um Certainly, accidental trauma from that happens
Right.
on our freeways, during sporting activities. That's not uncommon. But probably the most common patient for me is the natural wear and tear of discs in the lower back and the neck. And the surprising thing about the neck is that it can take away function like coordination or strength without causing so much pain sometimes. And
Mm,
you can literally be unsteady or have like an entire leg that's weak from a disc in your neck, which
mm,
I mean, I guess I've done this long enough to see it all. So those strange ones always stick out in your head when you've done this for over 20 years. So
mhm,
the strange ones would be like if someone has severe back pain and there's no problem in their back, but the problem is in their neck or in their upper back. And we fix their
mm,
neck and their back pain goes away, or you fix their
mm,
neck and their headache goes away. Like the
mhm,
chronic migraines go away. Those are
mm,
what are the outliers.
mm,
Usually people come in with sciatica, severe back pain, mechanical issues. They can't sit well. They can't stand for a long time. The mechanics of their spine is off and they don't feel well. So that's another thing with spine health. It really affects our psychology more
yeah.
than more than many other I would say disease processes.
Mhm.
So
I've seen that,
Yeah,
a mentor of mine, she was dealing with horrible sciatica for
yeah,
a long time. And I could feel it in her. She went from like the happiest, most peppy, excited, lovey to like just serious. And I was just
yeah,
like, let's
yeah.
hit on sciatica for a second, because this is such a common thing. What have you seen with sciatica in terms of like what's you see leading to it and what helps, what doesn't?
Yeah, a lot of times it's actually something that causes tension in the muscle around the gluteus maximus, or around the butt muscle. And that tension a lot of times is not spine related, but sometimes
Mm,
it is.
okay.
So there's a performance muscle right there over the sciatic notch. Sometimes that goes into spasm.
Mm-hmm.
There's the quadratus muscle. There's a lot of like muscular connections there, but
Mm-hmm.
keeping the hip and the glutes flexible and strong is probably the best thing you can do for remedying that situation.
Mm-hmm.
But also recovery. So a lot of, we live in a very high performance society. So everyone's
Yeah.
go, 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 go. And I'm
Mhm.
Mr. Recovery. I love reset.
Mhm.
I love
Mhm.
resetting the nervous system. That's why sleep exists. That's
Yeah.
why we can't, that's why even the hard hitting CEOs, somehow Elon Musk like can sleep under his desk. I have no idea how.
Yeah.
He claims to sleep under his desk. I still would love to see this. Elon, if you're out there, like demonstrate it, because apparently no one else. I mean, I just couldn't do it. Maybe I'm spoiled or something, but I need a somewhat comfortable set of surroundings. And sleep is so important. It's such a huge reset. So we're testing out things like lucid dreaming
Mm.
to decrease pain. We're testing things
Wow.
like meditation, breath work. Those are like
Cool.
very, low barrier of entry, not
Totally.
complicated, not super interventional,
Yeah.
and they have a delta of positivity for our patients. So
Cool.
yeah, we're testing it all out, but I do think the recovery reset mindset needs to
Mhm.
enter the athletic world. So
Mhm.
you train, 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 but you also recover.
Mhm.
And for most of my patients, I say assess each day as a training day versus a recovery day. Each
Mhm.
day. And if you have the luxury of
Mhm.
not having to do something super strenuous and you feel like your body needs recovery, then do the reset things. The
Mhm.
cold plunge, the infrared sauna,
Mhm.
the the PEMF machines,
Mhm.
there's so many out there, and a lot of them have great benefits for this type for sciatica type of pain.
Nice.
Yeah,
Yeah,
but if
lay
there's this
outside on the grass, like with your arms behind your head for 5 minutes. Chill.
exactly,
Come down.
exactly,
Yeah, I can't echo that enough because I'm in the trenches every day with people and their training and their nutrition and their mindset. And more and more, the last thing people need is to be told to push harder. What I'm having to do now is teach people that it's actually more intelligent. That's how I have to do it. I can't be like, "Oh, you need to rest." I'm like, "No, that's more it's more intelligent to not push your body." So I hit the ego a little bit and they're like, "Yeah,
very important.
I'm being intelligent by recovering,
I like that. I like that. You have a knack for the correct lingo because you have to capture the audience.
You
You
gotta
other
be, yeah.
yeah, yeah, yeah,
Because the hard work mentality, which is important, has been overdone. And what I'm
yeah.
seeing is it's not just the overtraining. Like in the training industry, we talk about it like overtraining, training too
Right,
much. It's the
right.
combination of hitting the gym intensely all the time, and the rest of your whole life is also super stressful all day, and your
Yeah.
mind is going, haven't really super deep dived on that. So you're like being mean to yourself and feeling like you're not doing enough and failing in every way, and then can't go to sleep because you're just trying to, scroll your phone to not think about all that. And then you're sleep deprived and you do that all over again every single day. It's all of that combined, not just training.
Is more often than you can imagine around all of us. Like some of our dearest friends are doing that right now. And
hmm
yeah,
I
and
did it.
and yeah,
Sleep when I'm dead, baby. I'm successful. I don't need no sleep. Yeah. No, that was horrible. And everything I was getting worse results with more effort. That's what you get from that. Worse results with more effort.
exactly. I think that's a good way of putting it for the performance oriented
Mm-hmm.
clients, is to say, well, you're going to get worse results with more effort. I think
Yeah.
that's huge.
I see it constantly.
Yeah, who wants that?
Right. So that actually was my next question for you. I like getting burned in my own industry, so I'm going to ask you to try to burn us personal trainers for a second. What advice do you have for personal trainers and avid gym goers in terms of supporting the health of their spine? Because I would assume you see people come in with issues from that.
100%. I mean, again, having done this over 20 years, I've seen it all. And I'll give you
Hmm.
some small anecdotes, and then we'll get really deep into it.
Oh.
I had a small Asian lady who fractured her L1 lumbar vertebra just doing squats.
Mm,
Just the bone broke. You know how much force it
geez.
takes to break a bone?
Wow.
So yeah, she had undiagnosed osteoporosis. So simple, like your primary care physician sends you for a DEXA score, you go for it, you find out what your bone density is after a certain age. I think she was 50 plus. But those, like, again, those crazy anecdotes of my career stand out. So,
Hmm.
so she was all about training, all about training. So after we fixed her spine, we had to talk to her personal trainer, build her bone back up, and she got back to her squatting ability, but it took like 6 months. And had she just done some screening and preventative measures, and her bone was of good quality, she wouldn't have had that accident. Other ones, I mean, I just operated on a very avid sort of hiker, climber, and those patients, after spine surgery, you need to kind of put a leash on them because you're afraid that they're going to get out there and fall and
Hmm.
get an infection or something of that sort. But I would say the number one thing is you want a personal trainer that knows you, and you probably form this great bond with your clients where you know their anatomy, their body type, their physiology, their
Hmm.
tolerances. I think
Hmm.
that's really important
Hmm.
for very early on.
Hmm.
Um, I've actually been impressed by how great it is in the long term with someone that wasn't even into personal training or exercise program. If they connect with the right trainer, their life changes and they don't need me anymore. So we
Mm.
fixed their spine. And then I'm like, you got to exercise. It's like, oh, doc, I don't have time to exercise. I'm like, listen, this is for part of your disciplined spine health. You
Mhm.
have to have a good exercise program if you want to maintain a good core, which is, sometimes boring exercises. People don't like to do them. But I think there's some of the best exercises, everything from
Mhm.
planks to uh, crunches to lunges, getting the leg strong, leg strength, and gluteal strength. I think it's absolutely essential. But my advice would be get to know your client's entire like anatomy and physiology as much as possible.
Mhm.
Learn their tolerances, learn where their weaknesses are,
Mhm.
and if they have medical providers, put a call into them. Like I talk to our um the trainers for my patients a lot on a daily basis because some of our patients are super good after it. They've had like artificial discs placed in their neck. So let's say you have a very flexible neck and you've had 3 artificial discs placed. You feel great, your neck and arm pain went away, but you want to, maybe overhead lift, maybe a little above your ability.
Mhm.
I would try to temper that a little bit. Say, you're only
Mhm.
6 weeks post surgery or 2 months post surgery. Let's go to 50% of maximal intensity.
Mhm.
Let's go to 25% of maximal intensity. You're healing slower than expected. So I think those are really important. And then also, if someone's injured, don't get them right back to where they were and saying just work
Mhm.
through the pain. Let's not work through the
Ooh.
pain. Let's
No,
let's
no.
yeah, let's just assess the new tolerances
Mhm.
and only go to the edge of the tolerances. Keep active, but if the pain is pretty severe, you should get an X-ray, you should get an MRI, you should see a doctor.
Mhm.
Just to get an assessment. I think that's where personal trainers can be very useful because sometimes
Mhm.
you're the front line.
Mhm. Mhm.
Nobody and not everyone has a physical therapist or a functional medicine doctor or a physiatrist or something like that. So you guys are seeing patients on a daily people on a daily basis.
Yeah, and I'll add to that. One thing that I really admire about Western medicine, and I wish we had, is like if I went to a family medicine doctor and then I went to you, you would just be able to access on the back end everything that's all the notes, everything, all the history. We don't have that. Like if you're going to a chiropractor and a functional medicine doctor and me, and maybe you have a sports medicine, you just have all these different people. It's it's not the best. It's not the best the way that's set up, but I will say
100%.
make sure that you communicate with those people. Like, sometimes you get the awesome docs. Like I've got a client I referred to a GI hypnotherapy practice. It was a guy that was on the podcast. They have amazing results with this GI hypnotherapy. So she's going to them now, and she said they asked if they could be connected to you. I'm like, "Oh, I love them. Yes, please." Because sometimes I'm like, "Can you tell me what your chiropractor said?" And they're like, "Something like a late labrum." I'm like,
Yeah,
you know what I mean? It's not the best. It's not the best. So if that is you, if you do have all these different hands on deck and it's not Western medicine where they can access what the other professional said, like take notes, bring a notepad in there, do the notes on your phone and send
right.
to the other people, because it's invaluable to me when I hear, "Oh, they're going to a physical therapist and the physical therapist said this." I'm like, ding, ding, ding. We better not do any of those exercises. No jumping for them right now. And we need to stretch out this and strengthen. You know what I mean? So if you're listening to this and you're, going to the buffet of practitioners, it is your job, unfortunately. I wish it wasn't that way, but it is your job to communicate what you're getting from those different people to the other people that don't have a back end system like Western medicine has. Maybe someday.
Exactly. But they will. I think that's where some of these AI solutions will actually be really helpful in
Hmm.
healthcare, because you'll have like
Hmm.
you'll have your AI twin on your phone, which will have all of this. And
Yeah,
I think
true.
that's where AI will actually make a very positive difference.
Yes, that will be a godsend for sure. Okay, next question. What questions should people ask their spine surgeon?
So, I mean, obviously, number one is, do you really think I need surgery? And then number two is, how can I avoid surgery? Can I avoid surgery? Is it safe to avoid surgery during this episode?
Hmm.
And what are the likelihoods? And there are really interesting gray zone situations. For example, severe spinal stenosis, which is narrowing of the spinal canal in the cervical spine. If it's really severe, there is a unquantifiable risk of, say, getting into a car accident or falling off a curb and actually losing function in your arms and legs. So, and I'm not as someone that likes to scare patients. So I always tell them it's very unlikely. Now you have my number. Let's make sure your lifestyle is safe if you have severe spinal stenosis, and let's do regular follow-up so you don't start to drop objects or have difficulty with utensils or chopsticks. The Japanese have a great score for this. The Japanese score actually is how they use chopsticks. And there's ways of assessing
Nice.
your hand strength and your hand coordination, et cetera, to make sure that doesn't happen. But that's a really rare situation.
Mm,
Other things you should ask your spine surgeon is, if you're proposing a surgery, what's your success rate? What's your actual success rate in your opinion? And, can I talk to one of your previous patients? Do you have any, testimonials, real world testimonials
yeah.
that I can access? And also, I feel like, is there a lesser surgery that does the same thing? Is there a pain management technique that does the same thing?
Mm,
And what's the most definitive and what's the least invasive? And can they be combined together so we're both definitive, takes care of the problem, and less invasive, which
mm,
means less muscle trauma, less trauma to the body, and quicker recovery.
right. Yeah, I heard you talking about this. Could you share what improvements have been made in spinal surgery in the last 10 years?
Yeah, I mean, we so like we're a very unique practice. We're actually one of the only practices in the world that's researching this concept of a complete mobile arthroplasty of the spine. So, as you know, like hip arthroplasty means hip replacement, knee arthroplasty means knee replacement. Spine replacement has not had a day in the sun yet. So,
Okay.
spine replacement has always meant either an artificial disc from the front or rods and screws in the back, or something of that sort,
Mm-hmm.
which unfortunately many of those surgeries rigidify the spine, so the forces of motion travel up and down, and then you end up with more than
Right.
one or two spine surgeries, which is why it has such a nuanced reputation in healthcare. So I would say the biggest improvement, or one of the most, I would say, cutting edge, shocking things that we're doing right now, is we have a research protocol of doing a complete spine arthroplasty, where we put an
Wow.
artificial disc in the front of the lumbar lower back and an artificial facet joint, a mobile bumper facet joint in the back.
Whoa.
I'll send you the pictures. I don't have the models,
Okay.
but I'll send you their pictures because they're pretty dramatic. And
Wow.
the patient I was telling you about, Montana, is recovering right now from that operation, and she's doing really well. She couldn't sit for more than like a few seconds before feeling pain, and she couldn't stand for more than a few minutes before feeling pain. And the combination, because disc degeneration is responsible for severe sitting pain, and
Mm.
facet joint degeneration, the joints in the back of the spine, are responsible for inability to stand straight, inability to extend your spine. So she had
Okay.
both. So
Mm.
she had both. Neither, she couldn't sit, she couldn't stand, she was miserable. She was
Mm.
like lying down in a recliner most of her day.
Mm.
So after a very thorough investigation, including really fancy CT scans with spectroscopy and dynamic X-rays, and looking at dynamic motion of each motion segment, and listening to her and listening to her and listening to her, we came up with a solution for her where we replaced 3 of her discs through the front of the spine, which does require a belly opening, and a vascular surgeon actually does that for us, and
Okay.
then 3 artificial discs in the front, and an artificial facet joint, a mobile joint that looks like a bumper, looks like a large, almost shock absorber in the back, because almost a new suspension for your body. And we
Wow.
put that in the back, and that's very much hot off the press and under an IRB and getting investigated. And it has its own nuances. I mean, it has its own potential pitfalls, and they're very technical, and everything from where the center of rotation of the spine will end up, which is
Mm.
an extremely technical part of our surgical skills, to can you do something lesser in the back or the front, which we're always up for trying, like can we try with PRP and stem cells and get the pain to go away.
Mm-hmm.
Certainly
Mm-hmm.
we don't jump into that solution, but you said what are the latest, and I wanted to let you know that that's probably the latest hot off the press thing. The
Yeah, for
second thing
sure.
is
I haven't
the
heard of
second,
that.
yeah, exactly. I don't think many people have. It's called the 360 arthroplasty. So
Mm.
360-degree arthroplasty of the spine. And the trial, we've done about 50 patients so far. We have like 20 recruited and still ongoing. Mine was just recruited yesterday, and another one will be recruited today. So
Wow.
it's an investigational study in 2 approved devices by FDA, but they've never been combined.
Wow.
So that's what's interesting. And there's some centers that are showing some interest, but unfortunately, the freight train of spine has been, the gold standard has been spinal fusion, and fusion begets more fusion, so more fusion. So
Mm-hmm.
we have these beautiful constructs that do correct scoliosis and do correct deformity, but they're not giving your spine back to you.
Right.
So
Right.
that's where I have a problem with it. I'm like, a hip surgeon can say, hey, yeah, you can go back to running and surfing, but we can't say that about a spine
Right.
that's completely fused. So I think we
Mm-hmm.
have we're missing an innovation gap there, and I think that's
Mm.
I'm very much looking forward to that.
Very
Um,
cool.
but yeah, other new things in spine is endoscopy. So endoscopy, just like they do for bellies and stuff like that. Now we do endoscopic spine surgery. It's
Mm.
been around forever, but because of camera technology, because of how clear the tools can be, we can now do it routinely to access the spine without
Wow.
anything but a tiny incision.
Wow.
Super impressive. I mean,
That's
it's
awesome.
incredible, absolutely incredible. Those are the 2 big ones, I would say. The rest is mostly, again, we have AI around fusion. We have AI driven predictive analytics about how we correct deformities.
Mm.
So we have an AI tool that tells us the angles of correcting,
Wow.
kyphosis, which is a hunchback, versus, to create lordosis, which is that parentheses like arch that you want in your neck and your lower back.
Mhm.
And so we have some AI driven tools, but those are mostly with currently dedicated to spinal fusion. And so one of the things we're trying to do, for example, is to create a registry of motion preserving implants in spine. So all
Mm.
the patients that have motion preserving implants in spine can be followed through this registry
Mm.
to increase the strength of evidence
Right.
for not non-fusion strategies.
Mm. I just had this like image pop in my mind of like somebody in like 2178 listening to this podcast, and it's like, oh, they're getting close. They're getting close. They were almost there. That's what it feels like. Awesome.
Yeah, it
Yeah.
happened here first. You heard it here first, folks.
And you're based in LA. Where is your
Yeah,
practice? It's in
yeah,
LA.
we're based in
Go
Santa
figure.
Monica. Yeah, we're
Go
based in
figure.
Santa Monica, but we love Utah. We love Salt Lake. I've never had a bad moment in Salt Lake City. It's incredible, and you guys are so
Thanks.
gifted with so much nature. But yeah,
Yeah,
so we're based out of LA. We do have patients that come from all over. My
I'm
patient from
sure.
Montana came yeah, internationally, et cetera. So we're a very boutique practice, and we're proud of being able to spend the time with
Yeah.
patients. That's more than
Yep.
anything else. It's like literally, it does take a long time to really listen.
Yep.
So
Yep. I'm in the same boat. I'm like,
yeah,
I don't even know what my business is. It's not like any other business I know. And because of that, I can't handle very many clients at one time because
yeah,
we're going all in. So I totally get that. Is your website the best place for people
yes,
to
yeah.
find
So
out
I,
about
I
you
have
guys?
so I have a couple. So one of them is mine, which is because I'd like to do a lot of patient education. So
Cool.
it's DrVokshoor,
Hmm.
drvokshoor.com. And that's my personal one where I'm trying to be like more than a spine surgeon,
Yeah.
a life philosopher, etc. Writing a
Cool.
book, all that good stuff.
Oh, cool.
And
Wait, well, hold on, pause. What's your book about?
oh God, you have to put me on the spot. It's
Uh-huh.
not finished yet, and
I'm writing one too. So
it's
I
been
get
going on for 8 years. This is actually about the
mm.
power of thoughts.
Oh,
So
nice.
yeah, like
Let's
it's
go.
very neuro related. So it's like
Very cool.
neuro and philosophy and life lessons all in one.
Well, when you get it published, have your
Yes,
people reach back out to me and we'll get
I
into it.
I would love
Neurotransmitters
that.
and how they impact us are like a huge area of focus for me, and obviously do the mindset
Yes,
coaching and
yes,
just the whole biology belief kind of Bruce Lipton-y stuff kind of set me on that whole tirade, and
love
that's
that about
very
you.
much
I
a
mean,
part
that's
of.
one of the reasons I was really stoked to be on this podcast because I think you're really you're translating very difficult concepts for
Mhm.
everyday people in a way that doesn't annoy them with too much
Thanks.
woo or too much Sanskrit.
Yeah,
It's like
right.
this is what makes sense, and I
I'm
love that.
open to the woo, but I need some sort of scientific validation too. We can't just go full woo and now we're just living in la la land. I'm a little, you know what I mean? I'm in both worlds, and I think you kind of, it sounds like you dabble
I'm
to
right
one
there with
foot.
you.
Yeah,
I'm right there with you.
cool. Okay,
Yeah.
sorry, I interrupted, but I wanted to know. Now I'm glad I asked.
No, I love it. Yeah. And so drvokshoor.com. And then we have our practice is nsg-la.com. NSG stands
NS.
for Neurosurgical Spine Group,
Okay.
NSG dash LA.com. And that's our
Okay.
practice.
Awesome. All right,
And we have
guys.
a nonprofit. If anyone's interested in collaborating with us,
Mm,
it's INI foundation.org. INI
I
stands for Institute of Neuroinnovation.
cool.
Yeah, and that's it. We're doing a lot of really cool things, including the registry and the 360 arthroplasty study through that.
Okay.
We also have a mindset. It's really interesting you bring on mindset. I love mindset. We have a perioperative brain resilience protocol that we're trying to test out to see
Cool.
if we could measure your brain resilience markers before surgery, around the time of surgery, post surgery. Can we, number one, make the experience better? Number two, make the outcome better? Number three,
Mm,
be prescriptive with breath work, meditation, or other things to increase that
nice.
resilience prior to surgery?
Oh, nice. Amazing.
So
Now we're
mindset.
talking. Cool.
Yes,
All right. Awesome. And then also your Instagram, guys, you can follow him on Instagram. It's just at Dr. Vokshoor.
correct.
And that's Vokshoor. You guys probably saw it on the title of the episode, but yeah. And you have information there too. And I'm assuming maybe YouTube and other
Yeah,
outlets.
YouTube, Facebook, etc.
Cool.
We get, it's better to go through the office if it's a real consultation you're
Hmm.
seeking. But
Hmm.
every day I'm always surprised by how I get like a random consult on LinkedIn, and then somebody on Instagram is asking me something, and somebody on,
Yeah.
thank God I don't have Snapchat anymore, but that was it. But it's like too many platforms, right? Yeah, we
Yes.
have platform fatigue.
Yep, I
So
definitely had to just give up on Twitter or X. I'm like, it's LinkedIn. I'm like, I can't do it, dude. It's too many. It's
yeah,
too many.
it's a lot. It's a lot. It's a lot. Yeah.
All right. Well, wow, you're doing such big work. Thank you so much for also, on top of all the work you're doing, getting out on podcasts. I know it's a lot, but
Yeah.
there's so many people just living in the dark, they're just going to some, like, they don't even know. A lot of people don't even know what's available. It's just like, let me look up a doctor. Okay, I guess this is it. And so it's such a gift when somebody of your level of experience and expertise and thinking outside the box is willing to come share with people. So thank you so much.
Really appreciate that. That means a lot. And I have mad respect for people like you who are helping everyone sift through the fog of
Thanks.
information overload.
Yeah.
That's your number one job, and you're doing it really well. And I really respect that.
Thank you so much.
Yep.
Thank you so much for joining me on this episode of the Inside Out Health Podcast. I hope it's been helpful to you in your journey. If you think that it might be helpful to someone you know, please share it with them. Please share on social media. It really helps me grow the show and reach more people with these amazing messages. And if you could be so kind as to rate the show and possibly even leave me a review, that really helps. So much thanks in advance if you do that. And yeah, please subscribe if you want to hear more of this type of content. I have lots of amazing expert guests on the way. All right. Thank you.